Negative pressure wound therapy, NPWT, also known as vacuum-assisted closure, VAC, is an advanced wound care technique that promotes healing by applying controlled negative pressure to the wound. It accelerates wound healing, improves circulation, and reduces infection risks. This guide explores NPWT's mechanisms, applications, benefits, and challenges in wound care. NPWT is a wound treatment method that applies a vacuum, negative pressure, to a sealed wound dressing, which helps draw out fluids, reduce swelling, and stimulate tissue growth. It is particularly useful in treating complex wounds, such as surgical wounds, pressure ulcers, diabetic foot ulcers, and traumatic injuries, where standard wound healing may be slow or problematic. Negative pressure wound therapy was introduced by Dr. Louis Argenta and Dr. Michael Moriquaz at Wake Forest University in the 1990s. They pioneered the use of negative pressure to enhance wound healing, demonstrating that controlled suction could stimulate tissue growth and effectively manage wound fluids. Their work revolutionized wound care, leading to the development of modern NPWT systems that are now widely used in clinical settings around the world. The NPWT system consists of a foam or gauze dressing, a tubing to create a seal, and a vacuum pump. After the dressing is applied to the wound, a transparent adhesive film covers the area, creating a sealed environment. The pump then generates negative pressure, which draws fluids into a collection chamber. The pressure is adjustable based on the wound type and healing requirements. To begin NPWT, the wound is cleaned, and a foam or gauze dressing is placed over it. A vacuum-sealed drape is applied, and a tube connects the dressing to a vacuum pump. The pump creates suction, gently pulling the wound edges together and removing fluids and infection-causing material. This continuous or intermittent negative pressure optimizes the healing environment, typically with dressing changes every 48 to 72 hours. NPWT is widely used in treating complex wounds, including chronic ulcers, pressure, diabetic, and venous, post-surgical wounds, skin grafts, and traumatic injuries. It is particularly beneficial for wounds with excessive drainage, large surface areas, or risk of infection. NPWT has become a cornerstone in reconstructive surgeries and is valuable in managing difficult-to-heal wounds across various medical specialties. NPWT promotes healing through several mechanisms. It draws wound edges together, removes exudate, fluid, that could lead to infection, and creates a moist environment that supports new tissue growth. Negative pressure also enhances blood flow to the wound, bringing nutrients and oxygen essential for tissue repair. It is known to increase granulation tissue formation and reduce the wound's bacterial load. The primary benefits of NPWT include faster wound healing, reduced infection rates, and minimized need for frequent dressing changes. NPWT also helps decrease wound size by promoting tissue growth and removing excess fluid. It reduces the need for more invasive procedures, such as skin grafts, in certain cases, and can improve patient comfort by decreasing dressing frequency and managing wound odor. While NPWT is generally safe, it can cause complications if not used properly. Risks include pain during dressing changes, tissue damage if negative pressure is too high, and potential infection if the dressing seal is compromised. NPWT may not be suitable for wounds with exposed blood vessels, necrotic tissue, or certain fragile skin types. The cost and need for trained staff can also be limiting factors in some healthcare settings. NPWT devices can be expensive, with costs varying based on the system and treatment duration. In the United States, NPWT can range from $100 to $400 per day, with total costs reaching thousands of dollars for extended use. Insurance coverage is variable, and while some plans cover NPWT for specific conditions, others may not. Accessibility in low-resource settings remains a challenge due to these high costs. Recent innovations in NPWT include portable, battery-operated devices that allow patients greater mobility, enhancing their quality of life during treatment. Digital devices with remote monitoring capabilities are also being developed, enabling healthcare providers to track wound progress and adjust treatment parameters remotely. These advances are making NPWT more convenient and adaptable to various care settings. Did you know that NPWT is sometimes used with skin grafts to improve graft survival? The therapy's ability to manage fluid drainage helps keep the graft in place and increases success rates. NPWT is also being explored for its effectiveness in treating wounds that are resistant to healing, such as certain diabetic ulcers, making it a valuable tool in chronic wound management. With advances in portable NPWT devices, patients can now receive treatment in the comfort of their homes, reducing the need for frequent hospital visits. Home-based NPWT has shown to be effective, especially for patients requiring long-term treatment for chronic wounds. Home NPWT devices are typically lightweight and user-friendly, with support from visiting nurses or trained caregivers for dressing changes. NPWT is not a universal solution for all wounds. It is contraindicated in cases with certain infection types, necrotic tissue, or poor blood supply to the area. Creating a proper seal can be difficult for wounds on complex body contours, and managing the pain during dressing changes can also be a concern. Proper training and experience are required to achieve the best outcomes with NPWT. Studies have shown that NPWT is highly effective in reducing wound size, lowering infection rates, and accelerating healing. Randomized clinical trials have demonstrated significant improvements in healing time for NPWT-treated wounds compared to traditional methods. However, more research is needed to optimize NPWT parameters for specific wound types and to confirm its long-term benefits across patient populations. NPWT is sometimes referred to as vacuum therapy due to its suction-based healing mechanism. In the future, NPWT may incorporate advanced sensors to monitor wound healing in real time, providing data that can adjust pressure settings for individualized care. There's also research into NPWT combined with antimicrobial treatments to target infections more effectively, particularly for patients with compromised immune systems. NPWT has revolutionized wound care, offering a powerful solution for wounds that may not respond to traditional treatments. Its ability to accelerate healing, reduce infection, and improve patient comfort makes it a valuable option in healthcare. Continued advancements and increased accessibility will likely expand its role, making NPWT a staple in comprehensive wound management. Thank you for learning about negative pressure wound therapy, NPWT. Its innovative approach to wound healing demonstrates the potential of technology in enhancing patient care. Through continued research and awareness, NPWT's benefits can reach more patients in need.